Interprofessional collaborative practice to me is just the way that ethical healthcare should be practiced. To me, it's common sense that we communicate with other healthcare providers and share what we know about patients to improve outcomes and help make and keep our patients healthy. Interprofessional collaborative practice means healthier patients and happier, more fulfilled healthcare providers. Interprofessional collaborative practice is important in my role as a care provider in several ways. I come from a background in geriatrics where much of care is team-based. For me, it was and always has been a way of life. I've been taking care of patients in the long-term care or nursing home setting for more than 17 years. And in geriatrics, not only the management of multiple chronic conditions needs to be managed, but all the other health issues surrounding access to care, from ambulation to transportation to the office, to payer sources and consent. These are huge issues that must be tackled and mastered before the dentist even starts to deal with the issues of the mouth. It becomes apparent pretty quickly how much quality of life and the oral cavity can affect each other, and also how much chronic diseases impact oral health and oral health care. I also teach oral medicine and dental treatment planning at the School of Dental Medicine. It affords the opportunity to work with dental students to help them get the whole picture of the patient so that we can help meet their needs more holistically and appropriately. There are multiple aspects in my role as a dentist in team-based care. Since I teach treatment planning and oral medicine at the dental school, I'm involved in helping to generate consultations when needed as students develop a treatment plan for their patients. I enjoy sharing with students and showing them that they play an important role as part of the healthcare team and that they can be conduits of information to other healthcare providers. They should approach the consultation not as what others can do to make the dentist's job easier, but what the team can do to help the patient have a better outcome. And this may mean explaining dental procedures in a way that other healthcare providers would understand and hence return the consult completed in a helpful manner. The consult is an opportunity to learn and explain to the recipient on the other end. I introduce students to interprofessional collaborative practice during learning retreats with Urban Service Track. We learn what others on the healthcare team do and their roles and responsibilities as part of that team. We discuss how important good communication is in the pursuit of ethical patient care, and we learn and model what it is to be a team member. Patient cases are presented and students learn how to work together to triage and prioritize answers to a case. They discuss who during a particular case would be the best leader for that team, and that is not always necessarily the physician. By watching the interaction of faculty working together with the students to complete the cases, they realize that learning is a lifelong pursuit and that often healthcare does not have one right answer. When I teach all the dental students in the more clinical years, 3 and 4, I use every instance I can to elaborate how patients interact with healthcare team members, and that as an oral healthcare provider, we need to work with all providers to learn more about our patients, such as the overstressed caregiver with a parent who has dementia, and how visiting nurses can help relieve some of that burden. How involving the physician, a physician assistant, or a nurse practitioner in managing postoperative pain medication may reduce falls for the patient, and that now the rest of the team can understand that it was the undiagnosed periodontal infection that was contributing to poor blood glucose management in a type 2 diabetic. I try to talk the talk and walk the walk in every encounter I can because it's how I practice and it's second nature. Thank you.